Hi, I'm Sam with Palmetto Family Medical Group, and this segment is going to be called Ask the Doc. Today we have Dr. Durham, our chiropractor, and we're going to be asking your questions to get you answers. Alright, so our first question for today is, why should I come in for an adjustment with my chiropractor on a regular basis?
Okay, Sam, what we look at with maintenance type care is a maintenance of health, obviously. And in that maintenance of health, we're wanting to check on folks' alignment and physical function. So that is impairments that we might catch early, things that we could find that we could correct before symptoms occur, so that we can continue a wellness type of actual health care for our patients instead of a reaction to sickness or symptoms. So coming in regularly just to get checked, even when you feel well, helps you keep feeling well, and we want to maintain that high level of health as much as possible.
Okay, that makes sense. So going off of that same question, our next one is going to be, how often should we get adjusted?
Typically, patients that are on some kind of maintenance care are doing their daily routine at home, so it's not that they just come in once a month for some magical adjustment. They have a routine at home that they're trying to watch their nutritional choices, they're trying to have some regular activity. About 80% of our patients would choose a walk-in program, and then we also do stretching and different exercises at home. But once a month, once every 6 weeks, we'll have someone just to come in to check on them, see how they're doing. We may even evaluate their stretching techniques or any questions they may have, just to keep them in that wellness lifestyle.
All right, our next question for today is going to be, what types of pain can chiropractic care treat?
Pain is an interesting phenomena, and we typically lump all kinds of symptoms into pain, symptom generators, into just a general diagnosis of pain. But we have a lot of different things in our body that can generate pain. We have muscles that can generate pain, joints that can generate pain. We have different structures within the body that can generate pain. So we have different types of pain. We have myofascial pain, we have sclerotogenous pain, we have just a lot of neurological type of pain. So one of the things that I feel like the unique points of our office is that we are able to discern the generators of pain. So while a patient may just perceive that they have pain, it's more important as a clinician to understand, where does that pain come from? What is generating that pain? What is the source of that? So we can start to rehabilitate those symptoms and get out of that pain lifestyle into a pain-free wellness kind of lifestyle. So that's really the first thing that we're after with most patients in their patient care, is to get their pain level. It may be a 7, 8, 9, or even a 10. And we want to get that consistently below a 3, preferably a 0. And that typically will happen in the first 2 to 4 weeks of care. If it's very, very chronic, it may be 4 to 6 weeks of care, but that is our first initial goal in our acute care for the patient, is to get them symptom-free or very nearly symptom-free and able to go through their daily routines and sleep well and get back to a more reasonable lifestyle.
Okay. And I know you guys want to know this as much as I do, but talking about pain, do adjustments hurt?
Almost all the time, adjustments do not hurt, okay? And we're trained to make them very, very comfortable. There are some very unique situations where we can have a very inflamed part of the joint, and typically this is in a wry neck syndrome, or what people call a crick in their neck. We have a very innervated part of the joint called the facet joint that is very, very irritated, and we will try to move that and get some circulation and get some movement, get that physiology reestablished as comfortably as possible. But if it's going to hurt or you have any discomfort at all, we have a lot of communication going on, and I tell all the patients when we first get started that I have 2 rules about getting adjusted. And one of them is, if I do anything awkward or uncomfortable in any way, please let me know immediately. And the other one is, if I'm working on a sore place, and we will work on sore places to try to get them more functional and pain-free, but if it's within the patient tolerance, then that's fine. We'll get in and out of there as quickly as we can. But if it is beyond their tolerance, then let me know immediately and we'll discontinue that and try to work around another way. There's more than one way to accomplish things, and we certainly try to deliver our care as pain-free as possible.
Okay. Well, thank you for tuning in. Make sure you guys follow us, like and subscribe for more content and for the next segment of Ask the Doc.